Today, we have received confirmation of one more case of a patient who has tested positive for coronavirus. This brings the total number of confirmed COVID-19 cases in Kenya to 16. The latest is a close contact of one of the 8 cases we reported yesterday. The ministry, working with the county governments, has traced 646 persons who had come into close contact with the confirmed cases. 96 of these contacts have already been released from our follow-up program after completing the 14-day follow-up period. Those remaining in our follow-up list are 550 persons. All the patients, except one, who is at the coast, are still in stable condition and improving. 11 individuals are currently admitted at Bagathi Hospital awaiting test results. Yesterday, if you recall, we also addressed the issue pertaining to the public transport sector. We reminded those operating in this sector to adhere to the directive we gave on March 20th, 2020. It has come to our attention that several public sector transport operators have now resorted to increased fares as a result of this directive. I want to make an appeal to those in the matatu industry and others in the transport sector not to increase fares for our commuters. By so doing, it will be counterproductive as we continue to fight this virus in our country. You will remember that I had said from the beginning that every sector is going to take a financial hit in this crisis, and to expect that one sector is going to punish everybody else for them to maintain a scenario where they are earning as much as they could is immoral and unfair. And then therefore we are appealing to the matatu sector to kindly look at the situation, understand it, understand that the commuters they are carrying are not in the same position they were in prior to this. Some of them are not earning any money at the moment, and to appeal for their reasoning. As we indicated yesterday, we have suspended all flights effective midnight 25th March 2020, international flights, as one of the key measures to prevent importation of additional cases in the country. Let me reiterate that all passengers coming into the country between now and that day, Wednesday, midnight, must undergo mandatory quarantine, either at their own expense in hotels, in government-approved hotels, or in designated government facilities. I want at this point to issue an apology from the Ministry of Health and other government agencies that are involved in this exercise to the parents and the individuals who have been so inconvenienced since last night. We are aware that we had logistical challenges that we encountered as a result of the speed at which we wanted to move into quarantining individuals. And therefore we know that we inconvenienced people substantially, and for this we can only apologize and mitigate by saying it was absolutely necessary that we do so. I also want to thank those hotels that have already admitted the quarantined people, but to make also a passionate appeal. In a manner of speaking, business has been brought to you by steroids. We are appealing to you. These are people who came into the country without a plan to spend money in a hotel. If your normal charges in a hotel room are 12,000 shillings, you should be charging no more than 50% of that, or even 25% of that. This is business you didn't expect, and you are not going to get it. So to expect a person who had no plans of spending time in a hotel to spend or to pay the rates that you normally charge anybody else is again immoral and inconsiderate. So we are asking you, the hotels that have offered themselves for this purpose, to also charge reasonably, reduce the rate as part of your corporate social responsibility. It would help Kenyans. We are encouraged to note that majority of the people have complied with the measures we have so far announced. We continue to appeal to Kenyans to take the matter seriously and strictly observe the advisories issued, which are all aimed at containing the spread of the disease in our country. I thank you, ladies and gentlemen. Questions?
Yes. My name is Stephen Lepop from Citizen TV. The issue of mandatory quarantine appears to be becoming increasingly a challenge. We have received reports of stranded visitors at the Kenya School of Government, at the same time at the Utalii College. How is the government moving in to resolve the same? And number two is about the priest in Siaya. Maybe a brief from the ministry.
Any other? Yes.
Yeah, thanks very much. Mine is, since most cases, being on imported, some of these entry points, and also the JKIA, has some challenges in screening. What is being used to screen? Because if you have these imported cases, that one puts a lot of question marks in the manner of how screening is done at the major entry points, and especially the JKIA. How is it being done, and how can it be effective going forward?
Okay, let me respond, and then I'm going to ask Dr. Amoth to respond more precisely in terms of the medical aspect of screening. But the simple understanding is this. First, there is no problem of screening at JKIA. As a matter of fact, that is how we picked up the Burundian national who continues to be in hospital today. I think it is important for people to understand how the disease metamorphoses, because you can walk into JKIA or any other center, no temperature, nothing, and then a couple of days later, you show the signs. So the fact that you have been screened as you pass an airport is not in itself to say that you cannot or you cannot have the disease. But I'll let Dr. Amoth handle that one. A priest in Siaya, yes, we are aware that there was indeed one of the 8 people I mentioned yesterday was a priest who had traveled to Rome and had come to Kenya and is currently at Bagathi, in isolation in Bagathi. We have also done contact tracing with the people he came in contact with, and it is a continuing exercise. So thank you very much, Steve. Let me also say this. In regards to because you mentioned priests, I also want to say that we are very grateful to the religious bodies that have the whole day been telephoning us. Others have issued statements to say that indeed they will comply with what we directed yesterday. But I'm also a Christian myself. And I want to say that the fact that gatherings are not happening in churches and mosques does not stop spiritual and mental nourishments. You know, because when we go to church, there is spiritual nourishment. And if you notice today, the Bishop of Canterbury actually said that he will continue with his work virtually. So there is nothing to stop us from engaging with our spiritual nourishment via radio, via TV, via any other means. And there is nothing also to stop us from continuing to support our religious activities through M-Pesa, through other avenues of sending money so that our institutions, our religious institutions can also continue in a normal manner, even though we are not all meeting. So I want to thank them and indeed say that we are encouraged by what they are doing and ask them to continue praying for this country. One more, yes. Sorry? Oh, yes. Okay, sorry, I forgot. I think Steve had asked that question as well. Let me say this, Nasibo, that as I explained, I started by apologizing in terms of what happened yesterday and today. Now we have got a system working. And all the people who came in this morning and last night have all been dispatched to the various centers and the various hotels. So all those people have now gone out there and settled. A lot of them are settling, others are checking in. It is going to be continuous. This evening, we are expecting more people to come in. And the method we are using now is that we will give you a choice at the airport. You'll be given the choice at the airport of where you want to go. This arrangement had not been straightened out clearly yesterday. But wherever you go, whether you go to the designated government facilities, and we are expanding them as we go along, as the need arises, there will be in each facility, whether a hotel or otherwise, Ministry of Health officials who will be there with these people. There will be obviously security personnel as well in those places, essentially for protection and for help, to help those people in any manner that they may wish to get help. They are not prisoners. Let's get one thing straight. They are not prisoners. So policing is not for purposes of imprisoning anybody. It is for purposes of ensuring that there is security and they are being assisted. We are also training the hotel staff who are looking after these people so that they also don't expose themselves unnecessarily. I think it is good also to be appraised of the fact that probably none of them is positive. You know, probably nobody. So we don't want stigmatization of individuals who are themselves as healthy as you and I. The fact that somebody traveled simply makes their case necessary to test because of their exposure. But otherwise, they are not sick and they are not prisoners. And they are simply protecting themselves and then protecting Kenyans. It's a sacrifice that we all have to make. Thank you very much. I would like to ask Daktari to explain one or two things, including questions that had been asked informally here before I got here about the definition of self-quarantine. Again, you remember we explained it the last time. But I think it's good to repeat the exercise of self-quarantine. And to add also that as we do so, there are individuals who continue to abuse this freedom that has been given to them. And as that has happened, we have continued to pick them up because it is what we must do. Please, Dr. Amos.
Thank you, Waziri. Let me start by explaining what self-quarantine is. Self-quarantine means that you are in a room of your own, well ventilated, as I explained last time, probably open windows. Best case scenario is that you have separate hygiene or toilet facilities. In case that is not possible, then after each and every use of the toilet facilities, then you require decontamination, which you can easily be able to do with jig. You take 1 part jig, maybe 1 cup jig, 6 cups of water, and you can be able to use that to be able to clean the toilet. You also, during the self-quarantine period, in case you have a coexisting medical condition, you need to have your medicines ready with you for the next 14 days. If you are working, it means you don't go to work for the next 14 days, and you keep to your room. If you are supposed also to clean your linen, your tables, your bed, you can use the same 1 part jig, 6 parts water for decontamination. You are not supposed to share any of your toiletries, your utensils, things like toothbrushes. You should use your own. That is basically what self-quarantine is. Then in terms of the screening at the port of entry, once again, I want to commend highly our officers at the ports of entry and elsewhere who are doing a marvelous job under very difficult circumstances in view of a new disease that the world had never been exposed to. And I can reaffirm Waziri's position that indeed the screening at the ports of entry is going on very well, and that is why we're able to pick one of the cases of the Burundian national. What you need to understand is that me and you can now pass through the port of entry if I'm in the incubation period in which the virus is in my body but have not started exhibiting symptoms. So you'll take my temperature, it will be normal, I'll not be coughing, I'll not have difficulty in breathing. We told you last time that the average incubation period of the virus is 5.1 days. So if I pass today, the symptoms could start occurring after 5 days. So the fact that I've passed today and cleared fit to go does not mean that I'm not at risk, and that is why we are talking of self-quarantine and now mandatory quarantine, to be able to capture that period of 14 days and leave nothing to chance. Thank you, Waziri.
Thank you. Thank you all very much indeed.